Welcome to Light Up the D, a focus on what's happening in our community from the people who make it happen. Here's your host, iHeartMedia Detroit Market President, Colleen Grant.
Good morning and welcome to another episode of Light Up the D. I'm your host, Colleen Grant, and I'm joined today by two gentlemen from the Michigan Institute for Neurological Disorders, also known as MIND. We have Dr. Jonathan Fellows and Dr. Daniel Singer. They are both board-certified neurologists at the Michigan Institute for Neurological Disorders, Michigan's largest and most comprehensive private neurological practice. Dr. Fellows leads the MIND Alzheimer's Disease and Memory Disorder Center, discussing World Brain Day, the rise of neurological disorders, and recent advancements in neurological treatments. Please join me in welcoming from MIND Dr. Jonathan Fellows and Dr. Daniel Singer. Thank you guys for joining me today.
Pleasure to be here.
Hey, Dr. Singer, let's start with you. What is MIND?
So MIND is the largest private practice neurology group in Metro Detroit. We like to say in the neurology world that we see all comers. So people often ask what you specialize in, and although we do have some specialty centers that we'll mention, we sort of pride ourselves that anybody who has any kind of neurological disorder, whether it be something more mild or some severe, real scary stuff, we're happy to see that. We, over the last several years, have grown our footprint around Metro Detroit. We have 4 offices now. And so with our large team of physicians and advanced practice providers, nurse practitioners, and PAs, we are able to take care of a very large population that seemingly is in ever need of neurological care.
And what you had mentioned, the services, what specific services do you provide and what conditions do you treat?
So we treat, the whole host of neurological conditions from Alzheimer's and memory disorders, migraine and headache disorders, movement disorders like Parkinson's disease, multiple sclerosis, migraine, low back pain, muscle and nerve problems. So the whole host of anything to do with the nervous system, which would include the brain, the spinal cord, the muscles, and the nerves. We, do that with, I guess first and foremost, sort of service with a smile. We like to feel like we're a pretty affable group of people and want to help care for patients. And then we pride ourselves in having, high level of diagnostics and technology as well. So we have an imaging center. We have 2 MRI machines. We do nerve and muscle tests and brainwave tests, and we sort of try to fancy our practice as a one-stop shop where you can come and see the doctor and get your tests and get your results sort of all right on the spot.
And Dr. Singer, MIND has 5 centers of excellence. Can you tell us what is a center of excellence? Describe it, and what does it mean for patients and families seeking treatment?
In today's world, people want to see sort of subspecialists and people who see a lot of one disorder. And there are certain areas in neurology that require not only just some subspecialty, but in order to sort of keep up on the latest advances. And so we've broken our practice up to some extent into these specialty centers, which I mentioned previously, actually. So we have the Alzheimer's and Memory Care Center. We have a very large and active multiple sclerosis center where we take care of patients and do clinical research. We have a migraine and facial pain center, a movement disorder center with predominantly that's Parkinson's, but other movement disorders as well. We have a pain center with interventional pain doctors, and that's the 5.
And that's what gives you the opportunity to serve so many clients in so many different areas and nervous system issues they might be having, yes?
Correct.
Dr. Fellows, World Brain Day was on July 22nd, and it was aimed at raising awareness and offering brain health tips in all stages of life. What tips would you offer to achieve brain health? What are some like what you say, essential tips for keeping a person's brain healthy and preventing or delaying dementia?
There's a lot of things that we can do that we actually have complete control over. Some of them are rather obvious. The first would be things like smoking and drinking and what we call just habits. We know that there's a direct correlation between tobacco use and heavy alcohol use with the earlier onset or more robust sort of progression of dementia. So first and foremost, we want to counsel our patients to quit smoking. And then the literature is a little bit confusing in terms of alcohol because we use the term moderate, but then some people have different definitions. In general, we'd say 1 drink per day for women, 2 drinks per day for men. But again, the jury's still out in terms of that. Now, there's also some other interesting information on that, because when it comes to certain Mediterranean diets, some will promote a certain amount of red wine to go with that in terms of slowing down the aging process. So alcohol's a little tricky in terms of that, but certainly smoking cessation would be paramount. Another one that's really important would be weight loss and controlling things like type 2 diabetes mellitus. Those two things have absolutely been linked to, again, quicker onset of dementia and degenerative brain disease. Cardiovascular health and blood pressure management. The new recommendation would be, again, not 125, not 130, but below 120/80 in terms of blood pressure control, in terms of delaying the onset or slowing the progression of dementia. Sleep is a big one. We want to focus on good quality sleep, keeping blue light out of the bedroom, working on good sleep hygiene. That's an hour podcast in and of itself in terms of sleep management. We want to work on things like social engagement and cognitive engagement. We know that patients do better when they are actively involved with other people, when there are maybe lectures that they can attend. And it's interesting, we have a lot of patients that we see, and sort of individuals in their 70s, 80s, and beyond, they want to stay in their home as long as possible. But when we talk about some of these senior living arrangements, there's so many vibrant activities that they can become involved with. And there's lots of data, lots of studies to prove that that's actually highly beneficial in terms of preserving brain health and preventing the onset of dementia. Diet, again, we could talk for hours on that. But in terms of, there's the DASH diet, there's MIND diet, there's Mediterranean diet. But in general, we want to look for low fat, low red meat, low processed foods, fried foods, things like that. Eliminate those as much as you can from your diet. More fish and omega-3s if you're going to eat, quote unquote, meat. Heavy on the plant-based diet, heavy on berries, blueberries, strawberries, things like that. Fruits that are high in antioxidants and things like that. The last two are really important, and these we have complete control over. First would be hearing loss. There's a lot of interesting, very new studies that link hearing loss to an earlier onset of dementia. So we want to be really cautious and counsel our patients in terms of seeing the ENT, seeing the hearing specialist, and getting fitted for hearing aids, because there's a direct correlation with hearing loss and onset of dementia. Some of that could be if you're not hearing, you're not able to engage. That goes with some of the social stuff we just talked about. The exact etiology isn't completely known, but we know that's a direct correlation. And the last, which is absolutely the one we have the most control of and the most important, would be physical activity. So we know that patients who are more active, that exercise, have a lower incidence of, again, onset of dementia and slowing of progression of disease. And the recommendation would be aim for about 150 minutes per week of moderate intensity aerobic exercise, and then couple that with, resistance training or weightlifting. Patients will often ask, which one's better? And the answer is both. It's a combination of both.
Well, those are great tips, and anything we can do and that we can control to try to prevent the onset is worthy of trying to add into our daily routine. Can you give us a status on the status on the aging population with regard to neurological disorders? What is the status today with the aging population? Is it growing? Is it getting better? Are people taking better care of themselves in these ways that might be reducing the onset of dementia?
So I think it's a combination of a lot of those things you just said. So part of it is we are taking better care of ourselves, which means we are living longer, which also means that the incidence of overall or sheer number of cases of dementia are absolutely on the rise. And these numbers are staggering. Right now, the state of Michigan has about 200,000 patients with Alzheimer's disease. If we look at the whole United States, there's 7.2 million Americans living with dementia, of which these are over age 65. And when we talk about dementia, dementia is the umbrella term, and underneath that umbrella lies Alzheimer's disease, which by and large at any age group, Alzheimer's is still the most common form of dementia, no matter what age group you're talking about. But especially as you get 60, 70, 80 and beyond, we're talking about 90+% of all cases are Alzheimer's disease.
Wow.
The economic burden is massive. We've got a big problem with caregivers. We've got a big problem with how to care for the aging population. Now we have newer therapeutics that we're using now that require intense monitoring. So this is a problem that isn't going away, but in fact we have to come up with some big solutions in terms of how to manage these folks as we age.
Yeah, like you said, the aging population is just going to require more resources as the years go on. What does Mind's Alzheimer's Disease and Memory Disorder Center offer with regard to trying to help our aging population. And can you tell us about the progress and promising new drug therapies that are out there?
Sure. So we mentioned it a little bit before, but in general, again, at Mind, we have a lot of neurologists that can care for the aging population, in particular, any what we call degenerative brain disease, of which Alzheimer's disease would be by far the most common. The first and foremost, we would do what's called a history and physical examination. We talk to the patient, and really we want to talk to the caregiver as well. We want to really understand, I always tell patients, I want to hear what you have to say, but I also want to see what others are saying, seeing about you, what the outside is looking in, so to speak. So it's really important that family or caregivers come with the patient to the appointment. And then there's a host of diagnostic testing that we do, something as simple as blood work to look for certain vitamin levels, look for other what we call metabolic causes for confusion or memory problems, things like that. We always want to do some sort of a brain imaging procedure, preferably an MRI of the brain. There's no radiation with an MRI of the brain, and we can glean a ton of really good information about why cognitive problems could be going on from that. Sometimes we do what's called an EEG, where we look at the electrical brain waves, and we want to see if there's any asymmetry side to side, or what we call slow waves, looking for any slowing of the brain waves. And then ultimately, if we're really on the right track and we do some bedside cognitive testing, what we want to do then is we want to look for what's called amyloid. And amyloid is that bad sticky protein that gets into the brain and is responsible for Alzheimer's disease. Amyloid is what causes plaques. People hear about plaques all the time. You can't see a plaque. Plaque is something you can see under a microscope. But with certain tests like a spinal tap or even a blood test, or probably the most sensitive would be what's called an amyloid PET scan. That's a certain type of nuclear medicine test. And if the patient gets that test, then we can say with nothing's 100%, but with nearly 100% certainty that this patient has amyloid in the brain, and with the right clinical picture, that equals Alzheimer's disease. And once we do this onboarding process, which usually takes about 4 to 6 weeks to get that done in terms of testing, then we go on to discuss maybe one of the new therapeutic medications, which are called monoclonal antibodies. And there's 2 different drugs that are FDA approved right now for the treatment of Alzheimer's disease. And in a nutshell, what they do is we infuse these drugs either every 2 weeks or once a month. And what they do is they stimulate the body's own inherent immune system to basically make our own immune system eat away at the amyloid that's in our brain or our blood vessels. These drugs are not without side effects, but if we want to just summarize it in one sentence, these drugs can slow the progression of disease by about 25 to 70%, depending on what stage of Alzheimer's disease the patient's in. So we tell people all the time, these are very good. We're not at great yet, we're at very good, but it's certainly a wonderful first step in terms of treating these folks.
And this is the newly FDA-approved blood test?
So the blood test was, yes, there is a new FDA-approved blood test.
Okay.
It was FDA-approved in May.
Okay.
It thus far is not covered by Medicare or insurers to get it done yet. But the blood test is what's called a biomarker.
Okay, so Dr. Fellows, you were talking about a treatment.
Right, so Dr. Singer can relate to some of the biomarkers. That's something that will actually look for amyloid. That's one type of biomarker. Mm-hmm. And then the treatments are 2 different drugs that are given as infusions to get rid of the amyloid.
Okay, got it. All right, please continue, Dr. Singer.
So the new blood test, which we're hoping to be able to use clinically very soon, it's available clinically right now, but it's a cash pay basis, is a blood test to take. It's aimed at patients or people who are 55 years and older, who have some sort of cognitive concern with potentially a family history. It correlates pretty decently. So they did a study where they looked to see the correlation of the blood test, and they compared it to the PET scan and or spinal tap. And what they found was that if a patient had a negative result, meaning they didn't have this blood biomarker, there's about a 97% chance that they did not have Alzheimer's disease.
Wow.
And conversely, if they were positive, there was about a 92% chance that they did have it. So it's a pretty relatively inexpensive and easy, literally just a blood test way to screen a lot of individuals. Because it's not really commercially available yet, we as the neurologists are going to have to learn how to counsel patients, because there are, some things to be concerned about. Take somebody who's 55 years old, 56 years old, who's asymptomatic, but let's say both parents had Alzheimer's disease. On one hand, if there was something to do because we found out they were super high risk, other than all those lifestyle management things that we already spoke about, then it would be great. And that's sort of hopefully where all the research is going to go. Take somebody that we say, you're super high risk, maybe there's going to be a vaccine in the future. Maybe there's going to be a preclinical treatment to give these patients to say, you're high risk. We know that by the time you're 65, your risk is this, and 75 it's higher, and 85 it's higher. So because you're high risk, we're going to give you a treatment that as of this moment doesn't exist yet. Without that, other than the lifestyle changes, there are some medical ethical sort of discussions to have with patients. I hate to say it this way, but do you want to know?
Right.
Right? If there's nothing really to do, would it cause somebody, there's some psychological things that go along with that we're still trying to navigate. But as a general rule, in patients who are symptomatic, it'll end up being a great first step and may, in the long run, reduce the cost of working a patient up for therapies because we can say with pretty good certainty with just a blood test that they have amyloid in the brain, and therefore these amyloid-targeted therapies that Dr. Fellows was mentioning would be a good choice for them.
That gives you a chance to manage them
as early as possible.
As early as possible.
Correct.
Got it. Dr. Fellows, can you describe the importance of, we were talking about how important it is for early detection, specifically with Alzheimer's, but with the detection of any neurological condition, and what types of exams, tests, imaging, and other assessments you guys have available at Mind that are used?
Sure. So one of the most important things that we do in terms of patients with a memory problem is we look at a brain imaging procedure, and the most commonly ordered test would be a brain MRI scan. And when we do a brain MRI, which we are able to do at our office, this test would be done without contrast, so you don't need an IV or anything like that. And we're able to get a great deal of information. And the reason why it's important is because we want to first exclude other causes for memory problems. Has there been a previous stroke? Is there a lot of what we call white matter disease? Is there what's called hydrocephalus or extra fluid on the brain? Could there, God forbid, be a brain tumor? Is there evidence of previous brain trauma, or what we call subdural hematoma and things like that? So there's a lot of things that we do to exclude sort of another structural etiology. And then we go forth and say, is there an atrophy pattern? Atrophy just is a fancy word for shrinkage. Is there a certain shrinkage pattern of the brain? Is it more in the front part of the brain? Is it more in the temporal lobes? Is it more in the parietal lobes? And that can sort of help us sort of whittle away at what we call the differential diagnosis, or we sort of make a list of different things in our head of what we think could be going on in the patient, and then we sort of try to come to some conclusions of the next sort of diagnosis for the patient.
So, and what's so exciting is that you guys now have 4 locations. You just opened a Riverview location, so you can do more to serve more people across our community. Talk a little bit about the new Riverview location, Dr. Singer. It's like I said, your 4th, and why there, and are there different services that you provide there as opposed to your other locations?
You know, we've been trying to sort of get downriver, and one of the reasons is that we've been in, I'll say kind of more mid to southern Wayne County and in Garden City for many years, and then in Dearborn Heights. And what we found was that a lot of patients from the downriver community, they were driving north to get to us in those other communities. So we thought it was a good opportunity to expand into that area. We're really excited about our Riverview office. We have 2 neurologists that are full-time neurologists there. We have one of our nurse practitioners who is full-time there, and we are getting busier and busier. One of the things that is most exciting about that office is in the multiple sclerosis world. So one of the doctors who's there full-time is a multiple sclerosis subspecialist. And in the MS world, really the most what we call highest efficacy or strongest treatments in today's day and age are infusion therapies. And so as part of our office, we have a infusion center that is there where we'll be able to service patients, both the medications that we were mentioning for Alzheimer's disease are infusion, and then also in the multiple sclerosis world, we do a lot of infusion therapies. And so to be able to offer that service, those patients were driving from downriver out to our Farmington office in order to do that. And so to sort of bring it closer to home to them, I think has been a real plus.
And how often would they have to do something like that? What's the regular cadence of that?
Yeah, so in the multiple sclerosis world, there are a few different infusions we use. Some of them are every 6 months. Some of them are once a month. And then in the new Alzheimer's medications, the 2 that are out now one is once a month and one is twice a month.
Oh, so that's great to have a location.
So yeah, so some of that, I spend time on that side of town, and I have patients that I've been seeing in my Dearborn Heights office for a long time, and there's this barrier to get them just from a travel standpoint, to do the cadence of the treatment they need, and therefore sometimes we have to pick other treatments. Not my first choice as the physician, but I go to my second choice because it's what's convenient and what makes more sense for their lifestyle, and that certainly is part of the discussion. Now I think that we open this up more opportunity for them with more treatment options so that we can really try to cater to a patient's needs on an individual basis.
That's great. Do you guys see more growth in your future like that, serving a wider portion of the metro area?
Yes, and we are constantly looking to grow. We're always looking at new great neurologists to hire and people to join our team. We have been looking at other communities actually as we speak right now, just nothing to announce.
Yeah, well, as Dr. Fellow said, with the aging population, the need is going to be even greater, and being able to serve people in wider area across the metro will certainly be needed and valued. Many people are fans of Billy Joel, and he was diagnosed with normal pressure hydrocephalus, or NPH, which is most common in people over 65. Can you guys describe what is it that he has? What is NPH, and the main symptoms and the causes of the condition, the diagnosis and treatment? What's in for him?
NPH, or normal pressure hydrocephalus, in layman's terms, is water on the brain. It's a really important diagnosis not to miss. And part of that reason is because one of the reasons we do MRI scans when we see patients with memory problems is it can present with memory problems and be misdiagnosed as Alzheimer's disease. And yet the treatment's very different. So especially caught early, it's a very treatable disorder. We teach medical students that it has a triad of symptoms, and the way we have medical students remember it is we say wet, wacky, and wobbly, which stands for urinary incontinence or trouble with your bladder, difficulty walking, specifically difficulty initiating gait, some shuffling and initiating gait, and then memory problems. When that's caught early, because it's an accumulation of fluid on the brain, it can be treated and, quite frankly, reversed with a neurosurgical procedure called a shunt, where they put basically a drain from the fluid-filled cavity in the brain, and they drain it down into the chest, and it takes that excess fluid and continuously drains it off. And the symptoms are, it's what we consider a reversible cause of dementia if caught early. Interesting, specifically on Billy Joel, and I've tried to look, both as a fan and just as a neurologist, there's not a lot of information that I've seen about, treatments as far as like sort of where it was caught for him or what his doctors are doing or recommending for him. So it's unclear whether he's going to go through a neurosurgical procedure or not. But there used to be, back in the television days, there was a public service announcement, PSA commercial that said, were you diagnosed with Alzheimer's, but do you have these symptoms? Ask your doctor about NPH. And it really is true. It's kind of easy to miss, and something really important to find because it's treatable and reversible if caught early.
How long has the Michigan Institute for Neurological Disorders been around, serving our community?
God, the exact year. I don't know that I know the exact.
1969.
Okay.
Oh, wow.
See, that's why we brought Dr. Singer with. He knows the year. 1969.
Wow.
And number one, we love where we work. We're there more than we're home. So it's either our first or our second home. We're not really sure. And we're also really proud that we often say we are now on our third generation of doctors. So either folks have retired or unfortunately they've since passed away. But those were the first generation of doctors at Mind, some the actual founders of Mind, and they helped build the initial practice. Dr. Singer and I, we are, sort of entering into the older range of doctors. So we are now the second generation, and now we have some young 30-something doctors. So they are sort of getting closer to our children's age. So they're the third generation of Mind. So we're
exciting.
Yeah, really exciting, and we're particularly proud of that. And like we said before, we're going to continue to grow and expand our footprint as well.
Yeah, and the learnings upon learnings upon learnings that you guys can share and supporting each other and the new generations. It's so exciting, and it's understandable that you would be able to expand with all of the years and years you have of experience. That's great. So with that said, with those years and years and years of experience, what types of advanced on-site diagnostic tests do you offer at Mind? Do you have all of those advanced tests at all of your locations, or different advanced tests at different locations?
So at our main office in Farmington Hills, we have, everything that we've talked about. We have on-site imaging, including MRI. We have diagnostic studies such as EEG, which is used for memory dysfunction, as well as epilepsy, seizures and epilepsy. We have EMG testing, which is nerve and muscle testing. That's sort of we call it EMG, but it's really two-part test where you do the nerve conduction velocity. That's where we give you little electric shocks and measure how well your nerves conduct electricity. And then one of the doctors will take a little tiny, almost like an acupuncture needle, put it in the muscle, and we're able to measure how well the nerve and muscle communicate with one another. And with that test, we can diagnose things like what's called peripheral neuropathy. We can diagnose primary diseases of the muscle, and even more commonly, things like carpal tunnel syndrome, pinched nerves throughout the body, as well as pinched nerves in the neck and the back, stuff like that. We have an active pain management department when you talk about testing. So they do things called fluoroscopy, where they can actively find the exact area where a therapeutic like steroid or a lidocaine, something like a numbing medicine, can go right to the exact area where the patient is having a problem. So that's another sort of diagnosis therapeutic, all sort of wrapped up into one. And then we have our whole infusion center at Mind in the Farmington Hills location, and we also have infusion centers at two of our other locations, at Dearborn Heights and at Roseville. No, I'm sorry, Roseville and Riverview. See, I get confused. They don't let me out of Farmington Hills very often, so I don't have as much insight into that all the time. In terms of other testing, some of the EEG, EMG, those can be done at any of our offices. Is really done at our Farmington Hills office.
And how do most people find out about you? Are they referred from their doctor, or are they like, there's an issue, I need to make a phone call? How does it come about that somebody ends up in your offices?
I think it's both. So a lot of our referrals come from our colleagues that are primary care doctors, whether they be internal medicine, family practice, things like that. But quite frankly, we get a lot of patients that, a great example would be, you have multiple sclerosis, for example. Well, the MS community is a very tech-savvy, tight-knit group. So they have Facebook groups and social media groups, and they're say, oh, I have this great physician at Mind. You should get an opinion from them. So a lot of them is word of mouth from individuals who have a similar disorder. And then also we see, family members, like, say, for example, mom has migraine, for example. It's not uncommon for us to see all the kids with migraine because migraine has a genetic component, much like a lot of other neurological diseases.
That's interesting. How is AI going to affect your business?
AI will affect every business, and medicine not excluded. I would say, medicine, we're a little bit probably more behind on that. Interestingly, we just had some folks come to our office, and they had sort of like an add-on module to our imaging suite. And it was very interesting what they were showing us. And an AI model could sort of take the information or the data that an MRI machine is able to sort of give us an image, and they can dive in even deeper and look at an MS lesion and give us more information. They could look at a brain that is being treated with one of the Alzheimer medications, and they could help us sort of understand if there's a early side effect associated with the therapeutic that we're using. Lots of things in terms of early detection of disease. Other things that AI can be helpful with would be just managing your business and sort of evaluating all the vast amounts of data that's sort of crammed into our what's called EMR, or electronic medical record. So there's a great opportunity there. Do you have anything else on the AI end?
Well, I think patients often get frustrated in today's day and age that doctors are often looking at their keyboards more than they're looking in the patient's eyes. And where I think that AI is going in literally in an office setting is there's going to be an AI microphone just recording and documenting the conversation, which will allow for especially doctors who aren't necessarily great typists per se, in order to have a little more of face-to-face human interaction, so the patient can feel that the doctor is engaging with them instead of just engaging with their computer.
Yeah, no, that's a huge advantage. Dr. Singer, do you love what you do?
I love what I do.
What do you love about it?
I grew up, my dad was a doctor, and I love interacting with people. And unfortunately in neurology, actually speaking of AI, in preparation for a lecture that I'm giving in a few weeks, I was working on it this weekend, and I asked ChatGPT, what are the top 3 medical diagnoses that people are afraid of? They actually gave me the top 3, and then they gave some honorable mentions, 2 more. And of the top 5, neurological disorders were 4 of the 5. So number 1 was cancer, all told. Mm-hmm. Number 2 was Alzheimer's disease. Number 3 was ALS, Lou Gehrig syndrome, neurological. And then in the honorable mention was multiple sclerosis. So we often, unfortunately, have to navigate with patients and families through really difficult discussions and difficult diagnoses. And I enjoy that part of it. I enjoy sort of being there for the patient and the families. And, there's all this stuff that we as doctors complain about with electronic medical record and billing and all of that stuff. But the true, when I'm in a room with a patient, that's really what I love to do. And I can put up with the other stuff because I really, back in school, I used to have what I called the Sunday night blues, right? So on Sunday nights, you didn't sleep well because you had to go back to school the next morning. I never, ever have that anymore. Wow. I'm happy to go to work. I like what I do, and I love interacting with patients.
Wow.
I work next to him sometimes, and I don't always see him not having the little blues. So, no, I'm just kidding.
Two good friends here.
Dr. Singer and I are very good friends.
You can tell. You can really tell. What about you, Dr. Fellows?
I do as well. I have a different take on it. I really love what I do for a few different reasons, but one of the main reasons, and do not take this the wrong way, because people make fun of me because I tell people that it took me 20 years. I've been practicing for 25 years post-residency, but I say it really took 20 years. When I hit 50, everything just started to click, and I would say I just really got great at what I do. That's what really gives me the best pride and honor, that I'm able to help my patients, help the community, because I do feel that I'm finally great at something. And that's really what brings me happiness, is knowing that I finally achieved a level of greatness, because I don't know that I've really achieved greatness in many other things in life. I think I'm a great dad. I'm a guy of wonderful children, but I finally figured out how to take care of patients. There's always a little snafu and things become difficult. Things are hard. We're not saying it's all easy, but that's one of my little tidbits that I can share.
That's fantastic. I love both your answers. Different and both wonderful, because you feel so fulfilled in what you do. It's great. Dr. Singer, you guys have provided so much valuable information today. There's somebody out there who's like, oh my gosh, I really need their help. I need to get some more information. Where might they find it?
We have 4 physical locations. Our main office in Farmington Hills, and we have offices in Roseville, in Dearborn Heights, and in Riverview. Conveniently, you can reach all of them with one phone number, which is 248-553-0010. So that's the phone number to make an appointment at any of the offices. And you can reach us online at our website, which is mindonline.com. mindonline.com.
mindonline.com. Our guests today have been Dr. Jonathan Fellows and Dr. Daniel Singer, neurologists at the Michigan Institute for Neurological Disorders. Thank you for joining us today. I sure appreciate it, guys.
Appreciate it.
Thank you.
This has been Light Up the D, a community affairs program from iHeartMedia Detroit.